Echinococcus, A One Health Perspective by John. Echinococcus is a very small tapeworm. There's a microscopic picture there on the right. It has a very pronounced scolex or mouthpiece where it does a lot of the damage when it's attached inside the human body. The parasite also causes the same type of disease in some animals. The Echinococcus granulosus causes cystic hydatid disease or cystic granulosis, and the Echinococcus multilocularis causes the much more severe alveolar hydatid disease. The thing about this parasite is that it is changing in its location. It's diversifying. It has always been seen as a parasite of the north, and now it is found in India, Canada, and north central US. And there's more than 1 million people affected at any one time. The groups of people that are of biggest concern are those who are immunocompromised, such as people on chemotherapy, or they've had an organ replacement, or a HIV patient. Also, those who work with animals, for instance, sheep, are known to be part of this cycle. So if someone has a sheep herd and they have sheep dogs who are allowed to eat infected rodents or sheep organs, that is a high-risk activity. Also, dog owners whose dogs are off-leash and eat infected rodents. And any one of us who eats food that hasn't been washed sufficiently and it comes from contaminated. So we're going to talk about 3 things: transmission, signs. So the next slide is going to have a schematic of the life cycle. The sort of abbreviated form of the life cycle is that the definitive host, who might be a dog, a coyote, or a fox, has the adult tapeworms inside its intestine. And the tapeworms produce eggs. These come out in the animal's feces. They're deposited on the ground. They become part of the soil, and so they're inadvertently eaten by the intermediate host, who could be a dog, a sheep, or a rodent, depending on what part of the world you're in. Then those eggs invade organs in those intermediate hosts, causing cysts. And then also humans can become infected by eating eggs from contaminated soil or unwashed food, or an egg that was attached to their pet's fur. So here's the schematic, and this comes from the Center for Disease Control website. It looks a little complicated, but it basically is just what I've just said. However, this shows the different forms of the parasite as it goes through its life cycle. Now, humans are considered an abnormal host or an aberrant host, and that's because they're basically a dead-end host. The parasite cannot continue reproducing it in its regular life cycle once it gets into a human, or a dog, if the dog is acting as an aberrant host. So, as already explained, the humans usually are infected through contaminated food or soil, or from petting their dog's fur. And the thing about this tapeworm is it's very difficult to kill once it's gained entry into an internal organ. So it causes serious damage to body tissues, both in the intermediate host, so that's rodents, and then in humans as the aberrant hosts. And also when dogs become aberrant hosts, they also get serious cysts in their livers. Signs and symptoms in humans is this cyst-like mass in internal organs, most commonly liver, but it's also can be lungs, kidney, brain, and the symptoms then depend on which organ is affected. The complicating factor for this disease is that it can lay dormant for as long as 5 to 10 years, and in one article I read it was up to 30 years before causing clinical signs. So at that time it's very hard to link where the person may have picked up the infection. Diagnosis is made by imaging, so that could be a regular X-ray, a CT, ultrasound, or MRI. And then there are additional blood tests or other tests that may be done depending on what kind of samples are received from the patient. This is a CT of a hydatid cyst in a human liver, shown with the black arrow. Management for a human would be that surgery is usually necessary, especially with the more serious alveolar hydatid cyst. So there can be, quite a bit of the liver have to be removed, for instance, or a lung. Drugs are used to kill the tapeworms, and for the alveolid hydatid cysts, it's usually a life treatment. Chemotherapy agents are needed because this cyst acts tumor-like in its growth. Prevention strategies are important, however difficult, because wildlife are definitive hosts and intermediate hosts, and whenever you have wildlife in a life cycle, it's pretty hard to control their movements. But here are some prevention strategies presented here. Certainly deworming wildlife by using some bait has shown to decrease infection rates. There's definitely cost involved, and it's not clear whether the cost is prohibitive for what is gained. Certainly regular deworming of pets, especially those who eat rodents. And then hand washing, washing food, those are important public health messages for a variety of foodborne diseases. And then the other thing is that there's, over the last probably 20 years especially, there's increasing encroachment of urban areas on wildlife habitat, and we need to be conscientious and allow for sustainability of our wildlife by trying to mitigate the negative interactions that our urbanization has on wildlife. So in summary, Echinococcus is an emerging infectious disease. It's an old disease showing up in new places. And as we've learned about in this course, as with other diseases, it needs a new approach. One Health, One Medicine is certainly a thing for the future. And it's basically defined as a renewed effort for medical and veterinary health professionals to work together.